Today we'll explore thyroid hormone synthesis and disorders, starting with the complex pathway that regulates thyroid function. The hypothalamic pituitary thyroid axis is crucial for maintaining proper hormone levels. It begins when the hypothalamus releases thyrotropin-releasing hormone, or TRH, which stimulates the pituitary gland to produce thyroid-stimulating hormone, TSH. This cascade ultimately controls thyroid hormone production. Understanding thyroid function tests is essential for diagnosis. We primarily look at TSH and free T4 and T3 levels. When these hormones are insufficient, hypothyroidism develops, leading to symptoms like hypercholesterolemia, hyponatremia, and anemia. Regular monitoring of thyroid levels is crucial for maintaining optimal health. Let's discuss treatment options for hyperthyroidism. The primary approach involves antithyroid drugs, with methimazole being a commonly prescribed medication. These drugs work by blocking thyroid hormone synthesis, but they require careful monitoring due to potential side effects. Beta blockers play a supportive role by managing symptoms like rapid heart rate and tremors, though they don't affect thyroid hormone levels directly. It's crucial to monitor patients regularly for adverse reactions and adjust dosing as needed. Drug interactions must be carefully considered, especially with medications that affect thyroid hormone absorption. Patient education is vital. They need to understand the importance of consistent medication timing and regular follow-up appointments. Moving on to thyroid hormone replacement therapy, which is essential for treating hypothyroidism. Levothyroxine is the standard treatment, but its administration requires specific guidelines. It should be taken on an empty stomach, and certain medications and supplements can interfere with its absorption. Now let's transition to diabetes screening criteria. Diabetes screening is recommended for adults over 45 or those with specific risk factors. The diagnostic tests include fasting plasma glucose, oral glucose tolerance test, and hemoglobin A1C. Each test has specific criteria. For instance, an A1C of 6.5% or higher indicates diabetes, and this correlates with an average glucose level of approximately 140 milligrams per deciliter. Understanding the risk factors and classification of diabetes is crucial for proper diagnosis and treatment. Type 2 diabetes risk factors include obesity, physical inactivity, family history, and cardiovascular disease. Certain ethnic groups, including African Americans, Hispanic Americans, and Native Americans, face higher risk. Type 1 diabetes, on the other hand, has a different pathophysiology, involving autoimmune destruction of pancreatic beta cells. The presentation can vary between children and adults, with children often showing more dramatic symptoms. Glycemic goals should be individualized, but generally aim for an A1C below 7% in most adults. The foundation of diabetes management lies in lifestyle modifications and appropriate pharmacotherapy. Non-pharmacological approaches are crucial and should be implemented first. Medical nutrition therapy, or MNT, involves developing a personalized eating plan that considers individual preferences and goals. Physical activity recommendations include at least 150 minutes of moderate intensity exercise per week. Weight management is essential, with even modest weight loss of 5 to 10% showing significant benefits. Smoking cessation is particularly important for diabetic patients due to increased cardiovascular risk. These lifestyle modifications form the backbone of treatment before or alongside medication therapy. Different classes of diabetic medications work through various mechanisms to control blood glucose. Insulin directly increases glucose uptake and storage while reducing glucose production. Sulfonylureas stimulate insulin secretion from the pancreas, while thiazolidinediones improve insulin sensitivity in peripheral tissues. Meglitinides also boost insulin secretion, but have a shorter duration of action. Alpha-glucosidase inhibitors work differently by slowing glucose absorption from the intestine. Metformin primarily reduces hepatic glucose production, while incretin-based therapies and amylin analogs affect multiple pathways to improve glucose control. Let's examine oral diabetes medications in detail. Metformin, a biguanide, is considered first-line therapy due to its effectiveness and safety profile. It works primarily by reducing liver glucose production and improving insulin sensitivity. Thiazolidindiones, like pioglitazone, enhance insulin sensitivity in muscle and fat tissue, but require monitoring for potential side effects. Sulfonylureas, such as glipizide, stimulate insulin release from the pancreas, but can cause hypoglycemia. Non-sulfonylurea secretagogues offer similar benefits with some unique properties. Each class has specific considerations for patient selection, monitoring, and potential adverse effects. Various insulin types and peptide analogs provide options for tailored diabetes treatment. Alpha-glucosidase inhibitors work in the intestine to slow carbohydrate absorption. Peptide analogs like GLP-1 agonists improve glucose control through multiple mechanisms, including enhanced insulin secretion and reduced glucagon release. DPP-4 inhibitors work by preventing the breakdown of natural incretin hormones. Different insulin preparations vary in their onset and duration of action, allowing for customized treatment plans. Patient education about proper administration and timing is crucial for optimal results. Understanding insulin characteristics is vital for proper diabetes management. Rapid-acting insulins, typically clear in appearance, begin working within 15 minutes and peak within 1 to 2 hours. Short-acting insulins have a slightly delayed onset but longer duration. Intermediate-acting insulins, usually cloudy in appearance, provide coverage for 12 to 16 hours. Long-acting insulins offer steady coverage for up to 24 hours or more. Mixed insulin preparations combine different types to provide both immediate and extended coverage. Proper timing of insulin administration relative to meals and activities is crucial for optimal glucose control. Effective glucose monitoring is essential for diabetes management. Self-monitoring of blood glucose should be performed at specific times, including before meals, at bedtime, and when symptoms of low or high blood glucose occur. Continuous glucose monitoring systems provide real-time glucose readings and trend information. Testing frequency should be individualized based on treatment regimen and glucose control. Understanding hypoglycemia symptoms and proper response is crucial. Symptoms can include shakiness, sweating, and confusion. Immediate treatment with fast-acting carbohydrates is essential when blood glucose falls below 70 milligrams per deciliter. Special attention must be paid to hypoglycemia management, particularly in cases of hypoglycemia unawareness. When patients experience multiple episodes of hypoglycemia or lose their ability to recognize early warning signs, their treatment plan needs comprehensive reevaluation. For insulin-treated patients with hypoglycemia unawareness or severe hypoglycemic episodes, raising glycemic targets may be necessary to ensure safety. Prevention strategies include regular monitoring, consistent meal timing, and appropriate medication adjustment. Long-term management focuses on restoring awareness through strict avoidance of hypoglycemia and may require adjustments to both medication regimens and lifestyle factors. Now let's test your knowledge with some practice questions. Question 1. A patient with type 2 diabetes is prescribed metformin and reports taking it with meals. The patient's blood glucose remains elevated. What is the most appropriate nursing intervention? The correct intervention is to instruct the patient to take metformin at the beginning of meals. Rationale. Metformin's effectiveness is optimized when taken with the first bite of food, which helps minimize gastrointestinal side effects while maintaining its glucose-lowering properties. Question 2. A client with hypothyroidism takes levothyroxine every morning with breakfast and calcium supplements. Which nursing intervention is most appropriate? The correct intervention is to instruct the client to separate levothyroxine and calcium supplement intake by at least 4 hours. Rationale. Calcium can interfere with levothyroxine absorption, reducing its effectiveness. Taking levothyroxine on an empty stomach and waiting before taking supplements ensures optimal absorption. Question 3. A diabetic patient presents with shakiness, sweating, and confusion. Blood glucose is 65 milligrams. What is the priority nursing intervention? The priority intervention is to administer 15 grams of fast-acting carbohydrates and recheck blood glucose in 15 minutes. Rationale. These symptoms indicate hypoglycemia, which requires immediate treatment with fast-acting carbohydrates following the 15-15 rule to safely raise blood glucose levels. Thanks for watching StudyNurseIQ. Follow us on YouTube at StudyNurseIQ, Nursing Made Simple.